You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co host, we interview the innovators in this space every week. Ivan, please get us started.
Hey, I'm Ivan Zach, and we are introducing a colleague of mine, Dr. Nathan Mitchell. Since the age of 6, Dr. Mitchell harbored a dream of becoming a veterinarian, a passion he combined with strong interest in engineering and building. After earning bachelor's degree in biology and Spanish from the University of Mary Washington and DVM from the Virginia Maryland College of Veterinary Medicine, he recognized the difficulties students faced in learning diagnostic skills. This led him to co-found Simon Education Systems with his brother and a mentor, a company dedicated to designing, producing, and distributing realistic and affordable veterinary diagnostic simulations to enhance student education. Nathan, welcome to the show. Thank you for finding the time.
Hey, thanks so much for having me.
So, tell us about Simon Veterinary Diagnostic Simulations. What does it look like? What is the simulation? What environment? Like, just what is it? What does the company do?
Yeah, so essentially, we create diagnostic simulations for both students and doctors to improve their skills with certain diagnostic tests. Specifically, the ones that we focus on are ultrasound and ophthalmic simulations. Ultimately, students don't get a lot of chances to practice this on live patients in school. And even when they do, it's not for a long amount of time. And so, by having good simulations, students can essentially practice these skills for unlimited amounts of time and ultimately improve their ability to practice that on patients.
So, just for the visual, because we're on podcast for people, because I've seen simulations, there's a 3D inside of the computer environment. I've seen simulations of, the cadavers that people try things on. Can you give us a little bit more of a sort of a walkthrough? What is it that you make?
Yeah, absolutely. So, regarding the ultrasound simulator, essentially we have these 3D printed probes that have RFID chips at the tip of them. And we have the users place the tags on whatever sort of patient model they desire. And so, what's sort of unique about this is that it allows the user to create their own simulator with whatever patient model that they have. So, let's say you put one tag in the spot of the liver, you connect your probe to the computer, you decide what videos you want to play when that tag gets scanned. And then when you scan that tag, it plays the video of the liver as if you were scanning the patient in real life. The probe also has recognition of rotation and tilt. And so the video itself changes depending on how you orient the probe. So that sort of makes for a very realistic simulation of actually performing ultrasound on a real patient. Additionally, these videos can be customized. So if you want to show normal versus pathological changes, and ultimately sort of test the students on what it is that they're seeing, that's certainly possible. And so you can show students an example of like a tumor or like an abdomen full of fluid versus maybe it's just something that's normal. But ultimately, you can customize the findings on ultrasound, which really enhances the user experience.
That's really cool. So it's like I can put a little tag in Sean's pocket and show like a liver failure from years of alcohol abuse, and it'll basically flag that.
Exactly. That's what the beauty of it is, that you can decide whatever videos you have, those are videos that you can then attribute to the tag. And so you can also decide where the tags go. The tags are adhesive, and so you can take them off and put them in different locations. But because of this, we allow for as much customization as possible.
Super cool. So I looked at your videos and we'll link them in the show notes so people can kind of get a visual representation. But I just want to make sure that I got it correct. So you, in the case of the ultrasound, you've got not a real ultrasound device, but something that looks like an ultrasound device. And then you don't have a real patient, you have a portion of a simulated patient. And by bringing those things together in what looks to be an ultrasound exam, you're able to simulate what would happen. Is that correct? Did I understand everything that you said plus the videos?
Correct. And that's what's nice about it, is the fact that it doesn't require you to hold down a live patient. Ultimately, you can practice for unlimited amounts of time on a patient model, because in order for students to practice ultrasound, it does require a live patient to cooperate with you, which risks the student getting bitten, scratched, kicked, you name it. And also, you have the patient itself that ultimately needs to cooperate, which does bring to question patient welfare as well. And so it sort of enhances both the user experience, but also it makes it much nicer for the animal because once you get to the point of practicing on a real patient, you're not moving the probe around trying to figure out what view produces what because you already know what you're doing.
Yeah, and also you'd have to have the condition that you want it to simulate cooperate as well, which would be another layer of complexity. So that all makes sense, and it sounds really, really cool. I mean, we had another student on the show several years ago that was making models to help with training. I'm curious if your reason for starting the company was the same. What's the origin story of what you guys are up to?
Yeah, so when I was a student, I'll never forget the first time I had a probe in my hand. I had no idea what I was doing, and the patient was moving around. The image didn't look that great. I was ultimately trying to do 10 different things at once. You're trying to recognize normal versus abnormal while also trying to figure out what view is what. And so, based on the fact that there's that frustration, but also your practice with it is very limited, I realized that there had to be a better solution to practicing this in a simulated sort of environment before trying it out on a real patient. And so I guess because of my failures and because of my initial bad experience with trying to perform it on a real patient, that sort of motivated me to create a solution to that problem by teaming up with my brother and my mentor and figuring out a good solution to this as opposed to sitting there and complaining about it.
I love it. It's amazing. How's it going?
It's been great. We've talked to a lot of different schools. It's amazing to see that this issue that I've had with learning certain diagnostic skills like ultrasound and also the ophthalmic simulators that we make as well. It's just something that nationwide a lot of students and schools struggle with learning just because of the like I said, the demand for a patient to sit still. You have multiple different students that are on a rotation. And so even if you do get time to give students a chance to practice, you're having to share that time with multiple students. But then also you have the natural demand for efficiency in a hospital setting. And so all of these things have created that sort of nationwide struggle of students not getting the proper practice that they need in order to be confident going into their first day of actually being a veterinarian. And so a lot of schools have really taken interest into this. We do have multiple schools that have started to incorporate these simulations into their curriculum and as a part of actually testing their students just because of how much they've enjoyed using them and because of how much they found that this has actually helped their students.
So is this mainly the ultrasound is your focus, or are there any other modules that are coming out, or this is what you want to target, just multiple videos of different organs with different pathologies in them and normals?
Yeah, so ultrasound was the initial sort of spark that started all of this. And funny enough, this didn't actually start out as a company. It more so just stemmed from my frustration and need to learn something. But I realized that frustration also applied to other things like ophthalmic diagnostics, specifically indirect ophthalmoscopy, where you're having to shine a light into the animal's eye and position the lens just right. And so I sort of had the same struggle with that. And that same day, I went home and started 3D printing, models of eyeballs, and I ordered images of retinas and went through different iterations of products. But ultimately, I ended up with a model that I was really happy with. And so that's another major thing that we make is a simulator for indirect ophthalmoscopy as well.
Yeah, it's really cool, Nathan. Like, makes tons of sense. Totally see the use case. What's the market for this like, though? And and where are you going with this? I think I can see teaching schools. There's only so many of them globally, but what's your market, and I guess where do you want to take this?
Yeah, that's sort of something that we had to discuss when we were starting this out is how big is this market? And we realized it's actually bigger than we realized because you're correct. We have teaching schools for number one is the primary focus here, but there are a number of different private practices that also have interns and residents and students visit on a consistent basis and they face the same struggles because in a private practice you're trying to be even more efficient. And so if you have something that you can allow students to practice with during downtime, they've actually taken a great liking to this as well. Then you also have a step below that, which is undergrad universities and high schools that do have veterinary centered programs that, and I mean, they're always eager to get their hands on something like this because most of those places don't even have an ultrasound probe for the students to use. And so you have this several $1,000 probe that you need to practice ultrasound with, or you can use what we've developed, which is under $500, and it allows essentially students to practice ultrasound for unlimited amounts of time. And so we've actually found that both high schools and undergraduate universities are also taking a great liking to this.
Do you think there's a market for continuous education as well? Because ultrasound is the one that I struggle with the most. And actually, in all our hospitals, that's the one that people are the most shy, I would say, is using as a full diagnostic tool, frequently underpricing the test because they're not comfortable with the test itself. So, do you see the potential direction there?
I'm actually really glad that you brought that up. Yeah, we are currently in the process of working with a couple of different places that do continued education. One of them, I'll give a shout out to Dr. Bliss. She's an amazing ophthalmologist that's centered out of Oregon. We're working on using these ophthalmic diagnostics for actually helping with continued education out there because she does a number of different continued education programs. We're also in the works of getting the ultrasound simulator as being incorporated as a part of continued education as well. And so I think that's a really good way to start teaching doctors, because that's a good point, is that it's not, this isn't just for students, because there are a number of doctors that still they enter practice and they just don't feel as confident with these skills because of the lack of sufficient practice that you naturally get while you're in school.
That's amazing.
So, what's the big dream? What does it look like in 3 to 5 years from now?
Ultimately, my dream would be to continue to do this. You know, it's difficult to find time as a rotating intern right now to try to make time for both producing this, but also trying to spread it. But my dream would be to continue to create more and more diagnostic simulations as I see, or I guess as I encounter more problems in the veterinary field, especially while working with students, because my hope is to remain in academia. And ultimately, while remaining in academia, I would love to bring my simulations with me and incorporate those simulations into the program and ultimately help improve the knowledge of students, because I think the faster we can prepare these students for what lies ahead and the better we can prepare them with these certain simulations, then the better doctors they're going to be just on day one and for the rest of their lives.
Yeah, that makes tons of sense. And it's so cool to see, the problem, the innovation, and then the kind of future vision that you have. I think it's really awesome. What are people saying about the devices that you've created once they get them in their hands?
We've gotten some really good feedback from people. I'm not going to lie to you, and that's not just me being biased. It's interesting that there's still the acknowledgement that this is more of a stepping stone, and the reality is this was never intended to fully replace practice with a probe or practice on a real animal. But ultimately, there's no good stepping stone between having no experience to all of a sudden having a probe in your hand and you're suddenly expected to know what to do with it. And so the schools that we've talked with and the private practices that we've started using this with have really taken a liking to it, and they've said that it's a great stepping stone and a great way for students to start to learn this stuff, because there's so much confusion when you start out with doing the real thing. And so the feedback has been quite positive.
It sounds like a wonderful Christmas gift for you, Ivan.
I guess. Um,
My struggling veterinary friend that's no good at ultrasounds.
Yeah, I think I'm trying to manage myself from out of doing ultrasounds, but it's interesting from the continuous education perspective. I wondered the interesting question is, so being an intern, that's we once calculated one intern where I went to vet school, that intern was getting about $2.30 an hour, given the hours that interns are used in the hospital. And so, what do your professors at school think about your hobby in parallel with it, and how do they support you?
Yeah, they've been nothing but supportive. They think I'm a little crazy to be taking this on during an internship, and especially when you're working in the ER and you have these crazy hours, it's not always feasible to try to find time. But especially after seeing how well this works with students, like during downtime, I'll actually pull the simulators out and I'll work with the students and I'll set up certain simulations and have them try it out. And I get a lot of positive feedback from them, but I think the professors also really appreciate that as well, because they see me sort of making that extra effort to teach them and to try to enhance their learning. But they've been nothing but supportive. They've given me pointers on certain things, and they know a lot more than I do as a first year veterinarian. And so when it comes to the simulators, they've sort of given me pointers and pointed me in the right direction of how to improve them, because I think they really do see the benefit that it has with students.
Well, they certainly don't know more than you as the new graduate, so that's the key to success there, because you're sorting the problem that you're seeing. Although I have a feeling that you might not get to academia, because if you get the entrepreneurial bug as you did this early, you're probably going to move on to the dark side of entrepreneurship. So that's just what we usually see here. Well, it's been a wonderful conversation. Where can people find about your product? Is it available out now? Can they find you on LinkedIn or on the website? And how do they connect with you?
Yeah, so the best way to view the products themselves is on our website. It's at www.simonedu.org. And then we have, Instagram, Facebook, Twitter, things like that that people can connect with us on. But ultimately, especially if you want to see videos of the simulators and if you want to get in touch with us personally, the best way would be through our website at Simon Education Systems.
That's amazing. So we like to wrap up every episode the same way. So I've got a couple questions for you before we let you go. First is a book, YouTube video, something that inspired you that's happened on your journey so far.
Yeah, I think as far as inspiration goes, I think my biggest inspiration so far has been both my mentor. His name is Stephen Wynn. He's both a physician and a DVM, as well as my brother, Stephen Mitchell, who's a software engineer. And ultimately, they were willing to sort of take me under their wing and help me develop this during a time when this wasn't exactly an entrepreneurial thing. We weren't really looking to get money out of this, and they were ultimately helping me just because of the fact that this was something that I thought would help myself with my learning. And so this ended up turning into a company, but I think that they've been my biggest inspiration so far because both of them were willing to set aside time to really help create these simulators and enhance them and really make it what it is today. And so I would have to say that my biggest inspiration so far has been both my brother and my mentor.
That's an awesome answer.
And the second question that we ask, is there another entrepreneur in this industry that you would, or an innovator that you would suggest inviting on this show?
Yeah, I think the best recommendation I could give you is her name is Bee Bittinger. She works at Michigan State and she is actually the one who runs the clinical skills lab there. She spends so much time with the students and she makes all sorts of different silicone models and different simulations. Essentially, what I do on steroids. She makes so many different teaching models that really help students and enhances their learning. And she's so passionate about it and she's such a kind person and she's very good at what she does as well. And so she would have such a great insight into the creation of simulations beyond what I've done. But I think that she'd be a really interesting person to talk to and a really great person for the show.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.